In California, involuntary treatment policy has remained largely unchanged since it was written and signed into law in 1967. So this change, SB 43, I think, as we've established, is a big deal.
Before supervisors voted whether or not to delay SB 43, which would allow more people with severe substance abuse disorders to be involuntarily treated, San Diego County's Behavioral Health Services Director Luke Bergman told the board this expansion would be far-reaching.
SB 43 will almost certainly result in many more folks being brought into emergency departments with similar presentations. But SB 43 comes with no new resources.
That's a major concern for the county's hospital systems, which supported delaying implementation for up to a year.
We're simply not ready today to start the system. None of our hospitals disagree with the context of trying to get people help. It's more about having a system in place so that we can be successful.
San Diego Mayor Todd Gloria spoke out against the vote to delay implementation. He understands that hospitals are already busy, but
they are caring for this population today, and then they discharge them onto our sidewalks. And I have to feel like San Diegans feel as though a hospital setting is a better place for very sick people, is better than the sidewalk, which is where they're ending up now. We've got to figure this out. And delaying is not going to help us figure it out. It's just going to delay us having to make the tough choices that we know are ahead.
Officials from the city's police and fire department say first responders are currently in a tough spot.
Police officers shouldn't be mental health workers on the street, but we get called because we're the only ones that have the duty to respond.
My firefighters, paramedics, and EMTs see the same individual cycles from the streets to the emergency rooms, back out to the streets, to jails.
In a 3-2 vote, supervisors ultimately agreed with Chair Nora Vargas's proposal to have more time to develop how this expanded involuntary treatment will actually work.
That our county team has never been afraid to implement smart policies or to address some tough issues. But I also insist that we've always been very careful and that we do things right and we do it well. Because we're talking about real people.
We can't overrun our emergency rooms. We just can't do that. We can't take that risk.
Supervisors Joel Anderson and Tara Lawson-Remer voted against delaying implementation. Lawson-Remer questioned county officials, suggesting they could have been moving quicker.
And I think I'm a little concerned that we weren't focused with the urgency and the crisis that I think that this demands.
Supervisors did agree to have staff report back in 90 days to assess if there's a possibility that this involuntary treatment expansion could happen sooner. Earlier Tuesday, the San Diego City Council voted to declare a behavioral health bed crisis. Part of that directed staff to explore easing zoning or finding additional funding to create more beds.
Not just for homeless people, it's for any number of people who don't have the proper care. And it's working with hospitals, first responders, a lot of the organizations that the city has to partner with, they are taking on the brunt. And we're trying to call on other levels of government to do what they can.
County officials say a lack of outpatient behavioral health beds often leads to people staying hospitalized longer than needed. The county has also been working on crisis treatment diversion programs to help keep people out of emergency rooms. Matt Hoffman, KPBS News.